How do we get patients to really understand why they need the care? And how do we get each team member feeling that they play an important role in that process?
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao. As I always, I want to thank my two sponsors, both Dental Intelligence and the Doc Sites, for their support. I really appreciate it, as do the listeners and viewers of my podcast. Today, I'm interviewing one of my speakers at my event. As you know, I have an event coming up September 29th and 30th called Supercharge Your Dental Practice in Delray Beach, Florida. It's focused on the business and marketing side of your practice. And this is one of my featured speakers on day 2. She's also one of my coaches, or she was one of my coaches. Her name is Susan Leckowicz, and the name of her company is Dental Coaches. Susan, thank you so much for joining me today.
Yes, my pleasure. I'm happy to be here.
So, you are one of my featured speakers, as I mentioned. Today's topic, everybody, is called team engagement. We're going to be discussing the benefits of team engagement. She is the CEO of Dental Coaches. She started her career as a teenage dental assistant for her dad, who was very passionate about dentistry. She spent 20 years as a dental hygienist before becoming a coach, and she has 16 years of experience as a coach, including me. She coached me probably for 3 or 4 years before I ended up selling, and you also coached the new owner of the practice as well. So she continued working with you after I ended my clinical career. So, Susan, let's talk about team engagements and the key to it being a great culture and productive practice. So, now more than ever, I think you'll agree that it's very important to have an engaged team. So can you start off with your thoughts about that?
Sure, I'd be happy to. So we have found that hearing from the team and getting their voice in what is happening in the practice can really help us key in with the doctors on what to focus on to get the team more engaged, to get the team more aligned with the doctor's vision and goals and core values, and to get the team being more effective, and to also help with recruiting better team members and hanging on to those key performing team players. So the work environment right now is very challenging. It's very competitive, and we are really working hard with our clients with this team engagement and effectiveness survey we've created, that we have brief questions, and it's a ranking of 1 to 5, and we're taking the pulse of the team. We're taking the pulse on the team to find out, where is the team aligned, and how can we get better clarity around our core values, where this practice is going, and how to attract better team members. So
obviously, having an engaged team has been really important for a very long time, but it's only recently that it's been getting, I would say since COVID, because hiring and keeping employees has been such a difficult thing after COVID hit. Why do you think, other than COVID, has it become really at a forefront nowadays?
It's very competitive in the marketplace right now, and a lot of people have left the profession, and I don't know if many people are going, into dentistry, into, assisting and hygiene like they used to. And I think team members are really looking for a fulfilling office and practice to work for. They're looking for good leadership. They're looking for better relationships with the people that they work with. And they're looking for, I think, just feeling more passionate about what they're doing and having a purpose, right? How do we get them really feeling good about providing great care? How do we get them engaged? How do we reward them? And, how do we get everybody focused? So, I don't know about you, Len, but you're a high performer. High performers want to work with other high performers, and when we don't have a good amount of high performers on the team, it just can kind of suck the energy right out of it. So it's just a way to really find out what's going on, and how can we help kind of move the dial with bringing more people together, around helping the doctor align with what he wants to accomplish, or she.
That makes a lot of sense. So you mentioned you have this survey that basically takes the pulse of the team. And I guess it also identifies areas that the practice needs to work on, correct? So can you
Yes.
talk a little bit more about this survey, the questions you ask, how long it takes, how often you want the offices to take it? Can you give a little bit of an overview of that?
So it's a 20-question survey. It's a ranking of 1 to 5, 1 being very low, 5 being high. It takes 5 to 7 minutes to take. We've timed team members taking it, and it starts off with really kind of asking questions about the leadership of the practice owner or owners. And it talks about core values. Does everyone know the core values? Do we hire around our core values? Do we have a way of, checking in and reviewing things with team members? What is happening around where the vision and the goals of the practice are? And when I talk with different clients, they'll say, yes, we have core values. Does everybody really know them or could recite them? I don't know. We've had some new people join the team. What we're doing is we're looking to see the variance of the scores, and we're looking to see like what's the most common answer, and how do we get this assessment to an 80%. So, maybe some people are scoring 5. This is a great place to work, where many are scoring 1, like how can we kind of get those numbers closer together? And we're looking at taking this assessment every 7 to 8 months. So we're identifying a couple key areas to work on, and then we're going to take the assessment again and see if we've moved the dial.
Based on your experiences working with, practices for, I think you said 16 years as a coach, what would you expect the numbers? Obviously, you haven't done it really. So what would you expect the numbers to show, or what would your expectations be from when you run the survey?
Well, it's a fascinating question, because every practice is different, right? And we really customize what we do. And, some of the doctors we're coaching are really strong on their goals, their vision, their leadership, and having strong key leaders on the team. Other practices, there's a lot of conflict. There's a lot of discourse. We've even found where there's bullying with team members now, that I've never seen before. So we're dealing with all these different interpersonal relationships, or these things that are not going well. And it's a way to, again, kind of figure out, where is this team? What do we need to work on? And how can we guide these clients on getting more clarity, getting more accountability for their team members? Many of the doctors we coach say, dentistry is the easy part. Managing the team is the challenging part. And the bigger the team, sometimes the bigger the challenges. And then the bigger the team, then we really work with a clinical team lead or an administrative team lead. Who's the influencer with this group, and how do they kind of align, with the practice owner?
You're obviously doing this survey for a reason. And I think, I can think of a couple of reasons why, but what are you hoping to learn? Are you looking to help other practices, with their engagement from their team from it? What is the ultimate goal of having a survey like this is really what I'm asking.
Well, the ultimate goal is to really help identify what do we need to work on? How can we get some honest and open feedback? And what we're finding is these team members, sometimes it's good just to feel that they're heard. Right? This, I'm feeling like I'm heard. I've been trying to tell the doctor this, or I've been trying to change things. I really like working here, but this is what's not going well. And I believe that stress is a large killer of productivity in an office, and a killer of the patient experience. Right? So if there's tension and stress and things happening between team members, patients oftentimes can feel that, right? And they can feel that energy. And, our goal is to be able to look at, having a team is important, right? Doctors can't do it alone. So how do we create a really great team culture? And then how do we keep it going? And how do we get the team members to even hold other team members accountable, right? How do we do team agreements that this is not how we agree to show up for our patients? And our goal and our what we're finding is that we can certainly help with systems and processes and things within the office, but then we've got to address that, kind of the elephant in the room sometimes is, how is this team getting along? And how do we help bridge that gap between the practice owner and the leader and the team members?
Interesting. So I'm assuming, I don't think you said it, but I'm assuming this survey's anonymous.
It is anonymous. So what we do is we share the most common answer, right? We say, okay, doctor, this question, here's the most common answer. Here are the action steps to get better aligned around your core values. Here's the action steps with better accountability. So we do keep it anonymous because, that's going to make the team feel safe, right? To be able to be, to be anonymous and to say, okay, then I'll give you my opinion as long as I feel safe, in giving it.
When I first bought my practice back in 2007, I was working with another coach. Her name was Lorraine Guth, and her name of her company was Motivations by Mouth. And when she came into the practice, things were a mess. I had just bought a practice. The dentist committed suicide. The team was all over the place. And she actually, when I sold the practice, that is one of the things that I kept. I actually have her book that she gave me with the survey results in there, because it was really interesting to see things that they were willing to tell anonymously were not things they were willing to tell me face to face. So when I looked at the results back then, and I actually looked at it when I sold the practice, it's really telling. It really made me look at things differently when I found the information about what the team actually thought about my leadership and things I needed to improve. So I think that's really good just to kind of get and you called it a pulse, but for the dentist to get a really, I think a much truer reflection of how he's looked at as a leader and an owner than you would get by, cause team members don't come to you. They don't want to say anything to you. They don't like there to be, that type of, what's the term I'm looking for? It's great communication, but they're afraid of having that interaction in the office and causing a rift between yourself as the owner or them as the team member. It doesn't work really well. So I think you may get some eye-opening results, or the doctors will certainly see some eye-opening results from what their team truly thinks of them.
And sometimes too, the doctors might say, I thought I was really clear about that. Like I told them this, there's some disconnect, right? If they're feeling they're clear in their communication and where they're going, but the team's like not feeling it or not getting it.
Gotcha. So where do you think, based on your years of coaching, where do you think most practices need improvements, even before looking at survey results? Where is your feeling where, hey, I know you're going to offer a link to the listeners and the viewers of this podcast to take that survey so you get their information as well. But what do you think, where do you think these offices lack the most in terms of when it comes to engagement of their team?
Part of it, I think, is having really good job descriptions and roles and responsibilities and accountability and like maybe one KPI, key performance indicator, to be responsible for, to report in on, to track, and many team members and some doctors will feel like, ooh, it's not about the money. And I truly believe that, a successful dental practice is successful at getting patients healthy. The numbers are a reflection about how healthy we're getting our patients. So we have to really believe in our heart of hearts, we're doing the greatest service that dentistry has to offer. We're offering our patients, and we're getting team members to really understand, well, what's my role in helping to get this patient to say yes and to keep their appointment and to, feel comfortable, because we know how patients are nervous, right? Patients don't trust sometimes because they don't feel the pain. And then, do I really need to do this? So how do we get the team engaged, and what's my responsibility as a healthcare provider? And I feel that everyone on that team is a patient advocate to help that patient, get healthy and get the dental care that they deserve to get.
You mentioned that you want to kind of empower team members to take control of certain things, have job descriptions, have really defined roles in the office. But one of the things you mentioned is you want them to kind of be in charge of one KPI. That's their baby. Do you find that when you do that, you empower the team member more by giving them that responsibility to be kind of reporting back about that KPI?
I do. And what I like to say too is numbers stimulate a conversation. Right? So even though I'm reporting in this number and maybe, my number is case acceptance percentage, right? How many patients said yes for this certain doctor? It's like, well, this number's dropping or this number has improved. Well, why do you think that is? Well, we kind of lost focus. The office, went through some kind of renovation and we lost focus, or, we've been using this tool, or taking more intraoral photos or doing more scans. And this has really helped us to get patients to yes. So it's a way for them to kind of, well, what do you think could be going on, that's affecting this?
For people that are listening to this, what are some, you have different defined roles in the office. You have your front desk team, people answer the phone, people handle insurance, those types of things. You have your clinical team, who help with the doctor with dental assisting, and you have the hygiene team who obviously deal with the hygienist or work on patients when they clean their teeth, scaling, root planing, those types of things. So, just for those that are listening, can you give, because, some doctors don't even know what KPIs they have to do. They have to look at when they run their business. And that's a big thing. And that's why I have, both Evan and Jessica Nunn talking at my event about numbers, one on the profit side and one on the practice side. So can you just touch base on a couple of KPIs that you think each kind of team member in the office can be responsible for or report on?
Sure. So, I really love working with dental intelligence because they create dashboards and they make it easy to track these KPIs. If someone doesn't have the ability to sync with dental intelligence, the right kind of software, we create shared Google Sheets and we create a way for them to track in their software. But I really like to look at production per hour for each of the providers, each doctor in the practice, and for the hygiene team. I like to look at the diagnostic percentage, how much treatment is getting diagnosed. And I like to look at how much treatment is getting accepted, how many patients are saying yes to treatment, what percentage, and what is the percentage of the dollars that is getting accepted. And in hygiene, I like to look at the perio percentage. I like to look at production per visit. I like to have them track their open time to see, what's happening with open time. Fluoride treatment percentage, I think, is important too, if that's something the office wants to focus on. And just by tracking numbers alone, numbers go up 10%. Just by looking at these and tracking on these and reporting on these. So, I know you're a big fan of Google reviews. So I always like to talk about the Google reviews. Every coaching call, I'm pulling up the reviews. Let's see what our patients are saying. Look what a great experience you're creating, for these patients. It's not just about, what are my numbers for this month. So.
Yeah, it's funny. I was going to bring up Google reviews next when you said that, because I think Google reviews are another big pulse of the practice.
Yes.
And again, you're, as the business owner, we'll look at it from the doctor perspective. You have your team reporting through this survey about how you're doing as a leader, but also you have the patients reporting about how your office is doing as a whole. And I think they kind of go hand in hand. And I would think that the practices that perform the best have better Google reviews than the practices that don't perform as well.
Right. Mm-hmm. Yes.
So to me, that's a big thing. If you're getting consistent reviews that are saying the team's amazing, that they're not having any issues, you're going to see all 5-star reviews for practices that perform the best, versus again, those that struggle, you're going to see some negatives based on, the communication skills of the office or insurance issues or something related to that. That's what I would think.
Right. Or the culture, right? How are we treating our patients? How are we, providing that great patient experience?
Got it. So I want to take this conversation in a little bit different direction before we go to the Q&A. So, this podcast is coming out a couple weeks before the event in September. Can you do me a favor and just touch base a little bit on what you're talking about at the event, so people who are listening and will be attending will get a better feel for what they're going to hear? And if they're not attending, maybe they will decide to attend because of what you're going to be talking about.
Sure. So My speech is going to be on how do you supercharge your bottom line on fewer PPOs. So oftentimes I'm working with clients on reducing dependence on PPOs and what needs to happen in your practice. What do they need to commit to create that better patient experience so patients are willing to come to them, spend more money, be loyal to them, refer their friends and family? And how do we get everyone on the team working on case agreement, not case acceptance? How do we get patients to agree to treatment? How do we get patients to really understand, why they need the care? And how do we get each team member feeling that they play an important role, in that process? So I'm a firm believer in lowering the barrier to care with good financial options, having membership plans for your patients who don't have insurance, and having team members cross-trained. So it's not just one person's a treatment coordinator and knows how to go over, what their options are for paying for care. We've created a financial agreement tool to help team members get really clear with patients and how do we get comfortable talking about the money? Can be an uncomfortable conversation. So we work a lot, we have some great ideas on how to help your team get really comfortable with this.
Gotcha. So that's great. I'm looking forward to that topic, as I'm sure a lot of people who are attending will be. But, one of the things you mentioned, and this was my next question, and you mentioned it, was you talk about case agreements, not case acceptance. That's one of the big things you do. So can you just describe for those listening? I know it's kind of a different topic, but I wanted to include that in here. Can you talk to the audience, the listeners and the viewers, and describe the difference between a case agreement and a case acceptance?
When I think of acceptance, I think of here, Len, you have to take this, right? You have to accept this versus how can we get them more engaged in, wanting to get this treatment done, right? How do we future pace them? How do we get them valuing this treatment to agree to it? Then how do we get really clear on, when they're coming in and how they're going to pay for the care? Because I really believe that people should be putting down some kind of skin in the game, putting some money down at time of scheduling in order to reserve your time with doctor. This is what we request. And we get really clear on a customized form, because what I worry about is people like, oh yeah, I'll say yes because they're pressuring me, but I'm just going to tell them I've got a work meeting that came up, or I'm going to call in, I'm sick, and I'm going to bail, on this appointment, but I don't feel really good about this, but they're telling me I have to do it, so it's really kind of getting that motivating factors with that patient and getting well connected with that patient. And it really has to be both the doctor and the team. It can't just be one person. So kind of leaning into those open-ended questions and being curious if people aren't saying yes. And then how do we follow up with them? Because we have a lot of team members that are working on, following up, 1 to 2 phone calls a couple weeks later, and they're bringing thousands of dollars back into the practice, and the patients are happy. Thank you for calling me. I know I needed to do this. And, thank you for reaching out. Here's your financial agreement form. Let's get you booked. And by tracking that in dental intelligence, it's really great. The team members feel really good about it too. It's a nice KPI to really track.
Got it. That's really good. Thank you for taking a couple minutes to do that. So can you let the listeners and viewers know how you help practices?
I work on really getting focused on the doctor's goals, right? What do you want to do? I really believe in creating the type of practice that makes the most sense. What procedures you want to focus on? What do you want to produce per hour? What type of growth plan do you have? Do you want to add an associate? Do you want to, increase your collections? And we really focus on right away, what's getting diagnosed, what's getting accepted, how are we scheduling it? How do we get the team focused, engaged? How do we reward the team? How do we celebrate the success with the team? And then how do we expand on that? So that's my, most successful practices will really want to impact the bottom line first and then decide, okay, you know what? I want to bring in an associate. I want to grow. I want to retire in 5 years. I want to have a baby and work one day less and bring someone else in here. I want to get off of some of these PPO plans. I want to shrink the practice down. So it's all very customized, but it's all about the bottom line, and we've created this team effectiveness and engagement survey and we use it, but it's not always just what that's all about. It's looking at what are they doing now and how do we get them more focused and systematized to improve.
Got it. All right. So let's switch gears. We're going to do our lightning round Q&A. So we'll try to get to 8 or 10 of these very quickly. Very fast answers. You don't have to go into long, drawn out answers. So first question, which 3 adjectives describe your strengths?
Enthusiastic, positive, driven.
This is an interesting question. What kind of culture exists in your organization and how did you establish it?
Yeah, great question. So I established it with my coaches and with the members of my team. And we spent an afternoon talking about what's most important to us. So we have, 5, values or core values of our culture, and they all got developed as a group. And we filter our discussions and our decisions all around those.
Okay. Who do you look to for advice or mentorship?
I look to a lot of different people, and I name my business dental coaches because I realize there's not one person going to know everything. I love working with Catherine Eitel-Belt. I know you've worked with her. I love getting advice from you, Len, because you really know what's happening in the industry. I love getting advice even just from my clients, and what they're hearing in the industry.
What have you read online recently that inspired you?
I have been reading Who Not How by Dan Sullivan and Dr. Benjamin Hardy, and I really love the excerpts from that book.
Got it. Okay. All right. What is the number one tactic that you use to stay organized?
I have a great team. Helps me stay organized. I don't know if that's a tactic, but I've got people I can delegate things to. And we are working with Zoho One as a CRM and using the tools in that. And I love my iPhone. I'm a big list girl and voice record.
Voice recording. Yep. That's exactly. Yep. What book do you think you should go back and reread as it's made a great impact on you the first time?
I want to go back and reread, the Energy Bus book. So we're going through that book with John Gordon, and he's got another one about engaged teams that I want to reread, that I've gotten a lot from.
What would you say are 3 skills needed to be a successful entrepreneur?
Hardworking, focused, and I think you need a coach. You need somebody, an integrator. If you're a visionary, you need somebody who's going to help you put it all together. You can't do it on your own, and grow. So
okay.
I've hired several coaches over my career and believe in coaching.
I've got coaching, so I understand that. How do you define success?
I define success in really enjoying each day with the type of work that you do and feeling that you are getting well compensated for what you do. So I think there's a lot of different ways. And the older you get, the more successful you want to feel and just the more comfortable you want to feel in your life and in your practice.
Okay. If you could take a class to learn anything you want, what would it be?
This is going to sound funny, but I did years ago, I did like a Skip Barber driving school class, and it was a blast. I would love to get in a race car and be on a race car track and take a driving class. I like to drive fast. So I'd like to drive a fast car.
That's good. And then last question, what is one subscription you cannot live without?
This one, Raving Patients Podcast.
Oh, well, hey, I didn't ask her to say anything about me during this podcast. So I know she said she looks at me for a mentor. I appreciate that. Looks at me for advice. I do appreciate that. And I'm glad you like the podcast too. So that's good. That's good. All right, Susan. So how can people reach out to you, if they want to learn more about your coaching, or how can they take this survey?
Anyone can reach me, Susan@dentalcoaches.com. And, in your show notes, I think you have the link to the survey, Len, and provide you the link for the team engagement and effectiveness survey. So any doctor who's listening to this can take this survey, and we will schedule a coaching call to go over the results and give you some tips and ideas on how to get your team more engaged.
And then I know you offer coaching consulting as well,
Yes.
where you do a snapshot through dental intelligence, correct? So do you want to just talk about that briefly?
Sure. Yep. I am very happy to do a complimentary growth report, dental intelligence snapshot, and a free coaching call on trends in the practice, and, give some advice on how to improve.
Okay. Anything else you want to say before I end the podcast?
Thank you very much. And I look forward to, hearing from any listeners, and to be continued. This is a great profession. And I think the more engaged and effective we can get teams, the easier everything's going to be.
Susan, thank you so much. That was great content. Thank you so much for spending 30 plus minutes of your time with me and obviously the audience as well. Guys, if you liked the episode, please share it. If you want to learn more about what Susan can do for your practice, please reach out to Susan. She gave her email address. And you can look in the show notes to take the survey, to see how the culture is in your practice and team engagement is in your practice as well. Remember, this is going to come out just 2 weeks from now, is my first live event called Supercharge Your Dental Practice. You can save $100 using the code RAVING. Go to superchargeyourdentalpractice.com or email me with any questions. And as always, remember, your reputation matters. Until the next episode, thank you so much for joining me and Susan, and we'll talk to everyone soon.